we should be talking about the fact that people with pre-existing conditions really don't have protections and doesn't work if you don't have actual access to a physician. So, Mr. Miller and Mr. Roy, I'll start with Mr. Roy. Can you talk about what could happen in the U.S. if private physician practices were not allowed to participate in a single-payer program, hypothetically, and would that create access issues for patients?
Well, we already have access issues for patients in the Medicaid program. A lot of physicians don't accept Medicaid, even though they theoretically participate in the Medicaid program. That's also an increasing problem in Medicare because there are disparities in the reimbursement rates between private insurers, Medicare, and especially Medicaid. And this is one of the other flaws in the ACA is it relied on a program with very poor provider access to expand coverage. I think the exchanges, at least, have the virtue of using private insurers to expand coverage rather than the Medicaid program with its much lower reimbursement rates.
So I would argue that, then if you go to a Medicare for all, you have access issues on steroids potentially. Roy, do you have any comments on that?
I do. I would just like to add that at the Foundation for Research on Equal Opportunity, we put together a detailed proposal for private insurance for all, where everyone buys their own health insurance with robust protections for pre-existing conditions and health status and robust financial assistance for people who otherwise can't afford coverage in a way that is affordable, that would actually reduce federal spending by $10 trillion over 3 decades, but would ensure 12 million more people have access to health insurance than do today under current law. So there are ways to address the problem of affordability and access of health insurance while also reducing the underlying costs of coverage and care and making the fiscal system more sustainable.